Good afternoon, and thank you for joining us for this very special edition of the Nevada Immunization Learning Exchange webinar series, Super NILE Flu Edition. This is Brianne Van Dyne, the Education Manager for Immunize Nevada, and I will be today's moderator. The flu-focused theme of this week's NILE webinars was purposeful. The convergence of flu with COVID-19 fast approaching, communicating the importance of influenza vaccination is more important than ever. Immunize Nevada is excited to be a part of the efforts to promote influenza vaccination coverage rates in our state and beyond for the 2021 season. Before we get started, I'd like to review a couple of housekeeping items. First, if we should become disconnected for any reason, please call right back and we will continue. Second, please locate the Q&A box on your screen. If you have any questions, type them there and we will address those at the end of today's presentation. Additionally, if you have requested continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended or in tomorrow's follow-up post-webinar email. All CEU certificates will be emailed out within the next week. Please note today's webinar is being recorded. The archived presentation and slides will be available on immunizenevada.org/NILE within 1 week. Before we begin, I'd like to provide a little disclaimer. Immunize Nevada's NILE webinars are made possible by the generosity of speakers who donate their time and expertise to benefit the coalition. The expectation and goal is for community partners to gain knowledge on immunization and infectious disease-related topics through a non-branded, unbiased presentation. And with that, we are set to officially begin today's featured presentation, Communicating with Pregnant Women About Flu and Tdap Vaccinations. I'd like to introduce Jennifer Zavolinsky. Jennifer is the Director of Outreach Initiatives at Vaccinate Your Family. Since joining Vaccinate Your Family, formerly Every Child by Two in 2003, Jennifer has been a leader in the field of immunization, collaborating with public health partners throughout the country to educate families, healthcare providers, WIC staff and participants, and policymakers about the safety of vaccines and the need for timely immunization for people of all ages. Jennifer serves on several committees and coalitions aimed at improving health through vaccinations, including the National Adult and Influenza Immunization Summit and several CDC work groups. Jennifer obtained her Master's of Health Science degree from Johns Hopkins University Bloomberg School of Public Health in Baltimore, Maryland, and her Bachelor of Arts degree in Psychology from American University in Washington, D.C. Welcome, Jennifer. Jennifer, are you able to unmute yourself?
Hi, I'm sorry. Little technical difficulties to start everything out, but hopefully we have it set now.
We do. Thank you.
Hi, everyone. As Brianne was saying, my name is Jennifer Zavolinsky, and I am the Director of Outreach Initiatives at Vaccinate Your Family. And next slide. For those of you unfamiliar with Vaccinate Your Family, I just wanted to let you know a little bit more about us. We're a national nonprofit organization, and we are headquartered in Washington, D.C. We were launched in 1991 by the former First Lady, Rosalind Carter, and the former First Lady of Arkansas, Betty Bumpers. And our mission is to protect people of all ages from vaccine-preventable diseases. And one of our main goals, particularly over the last few years, has been to educate pregnant women about the importance and safety of both maternal and childhood vaccines. And we have actually been working with Nevada's immunization coalitions and the health departments and medical associations in Nevada for quite some time. It's been many years. There was a time where we were working so much with you guys that I began to feel like Nevada was my second home, and I liked it a lot. It's beautiful out there. And So I don't know if any of you have ever heard of it, but it was the Immunize On Time, Every Time campaign, which was one of our big campaigns out there. And we did some billboards and some bus shelter posters in the Las Vegas area. So if any of you ever seen those, that was this project that we worked on with the folks in Nevada. Next slide, please. So today, I know the focus is mostly on flu for the full week, but we're actually going to be talking about the importance of vaccinating pregnant women against flu and pertussis, known as whooping cough, which helps protect both mothers and their newborns from dangerous infectious diseases. And on our discussion, we'll be talking about the vaccine recommendations from the CDC and the ACIP, along with the new call to action that has come out. We're going to go on an overview of the stats related to maternal vaccinations, talk about some of the motivations and barriers. We'll talk about research and activities being done by some national partners related to communicating with pregnant women about maternal vaccinations. And I'll mention a few of the activities that Vaccinate Your Family is doing. And then at the end, we'll have some credible resources, and we'll also be talking about other credible resources along the way to help you when you're talking to pregnant women about the importance and safety of flu and Tdap vaccinations. Next slide, please. Okay, so vaccinations for pregnant women. There is 2 vaccines that are recommended for pregnant women during every pregnancy. One is the Tdap vaccination, which protects against whooping cough, and it protects pregnant women and their babies from whooping cough when it's given during pregnancy. For those of you who are unfamiliar with the biology behind it, when a woman gets a vaccine during pregnancy, her body creates antibodies that are protective to help her be protected against whooping cough. And then she also transfers some of those antibodies onto her baby. And when the vaccine is administered in the 3rd trimester, particularly between the 27 and 36 weeks of gestation, the body's optimizes the neonatal antibody levels. So that's the best time for that vaccine to be given. And it's so important for the Tdap vaccine to be given to pregnant women because pertussis is so dangerous for young babies. However, and it's particularly dangerous for babies who are under 2 months of age, yet those, of course, are the children who seem to get it the most. And are also the ones who get it and are hospitalized from it and sometimes die from it. So getting the Tdap vaccine is really, during pregnancy, is a great thing. There used to be a vaccination recommendation that was talking about pregnant women getting the Tdap vaccine after they have the baby and making sure all the friends and family members also get Tdap, pertussis vaccinations to protect the baby. And this idea was like the cocooning idea where everyone around the baby is protected so the baby will be protected. However, that doesn't work perfectly. And so CDC and other scientists decided that it's a better strategy to vaccinate the pregnant women with the Tdap vaccine, and that provides the most protection for mothers and their new babies. And when possible, it's great if you could be promoting also to your pregnant patients that they should be telling all of their friends and family who are going to be around a new infant to get the Tdap vaccine as well, because it couldn't hurt to have that extra protection surrounding that baby. Regarding flu vaccination, flu vaccine is given or recommended for pregnant women and is safe to administer during any trimester. And flu vaccination is the best way to protect pregnant women and their babies from flu and flu-related pregnancy complications. Just like pertussis, flu is very, very dangerous for young babies, particularly 6 months of age and younger. And flu is also dangerous for pregnant women. because they have changes in their bodies due to pregnancy, and that makes them more susceptible to flu and its serious conditions, serious complications. It also makes it possible for the woman to have problems with her pregnancy. So more of a chance of preterm labor or miscarriage. So again, this is why we're vaccinating pregnant women with flu to protect both mom and baby. Also, the flu vaccine is helping give the baby some protection against flu till they're old enough to get their own vaccine. So they're not recommended to get their own vaccine until they're starting at 6 months of age. So they are really relying on the mother to provide that protection before the 6 months of age. And that is actually the same thing with the Tdap vaccine. They don't start their own series of pertussis vaccines until later. And so they're depending upon their mom to give them that protection. Next slide. So before I move on to the statistics related to maternal vaccinations and some of the motivations and barriers, I just wanted to bring up a meeting and partnership that we have been part of for about 2 years. It's called the Maternal Immunization Summit, and it's run by the Maternal Immunization Task Force, which consists of 4 different national organizations or associations: the American Academy of Family Physicians, the American College of Nurse Midwives, the American College of Obstetricians and Gynecologists, and the Association of Women's Health, Obstetric and Neonatal Nurses. And this group has been getting together and putting out different resources to help healthcare providers, particularly those of pregnant women, help them better communicate with pregnant women. They also just recently put out a immunization for pregnant women, a call to action. And if you go to the next slide, I talk more about what that is. So just a few months ago, this Maternal Immunization Task Force put out this new immunization for pregnant women, a call to action, in order to highlight the importance of Tdap and flu vaccination in pregnancy and the critical role that prenatal care providers can play in ensuring that pregnant women are vaccinated. And OBGYNs and other healthcare professionals are encouraged to commit to 5 key strategies that they include in this call to action. And you can see just this is the introduction from their call to action here on the screen. And I will be talking about the 5 key strategies a little later in the presentation, but it has the link on the bottom of the slide if you would like to see the call to action yourself. And the more we promote this call to action and the idea that not only does CDC recommend pregnant women get vaccinated, but all these other groups also, these top medical groups for pregnant women are also recommending that women get vaccinated during pregnancy. Okay, next slide. So here is just a little overview of the statistics. Most of this information comes from the CDC's Vital Signs, which was put out in October 2019, and they did a special issue of Vital Signs on pregnant women and vaccines. And here, hold on one moment, sorry, a little technical difficulty on this end. Pregnant women have more than double the risk of hospitalization compared to non-pregnant women of childbearing age if they get the flu. As I mentioned earlier, that's because pregnancy causes changes in the immune system and the heart and lung function, which makes women more susceptible to these flu-related complications. But the research shows that getting a flu shot reduces a pregnant woman's risk of being hospitalized due to flu by an average of 40%. And flu vaccination during pregnancy lowers the risk of hospitalization in babies as well, particularly those babies younger than 6 months old who can't get their own vaccines, by an average of 72%. 2/3 of babies younger than 2 months old who get the whooping cough vaccine, who get the whooping cough, also known as pertussis, need care in the hospital. Yet, Tdap vaccination during pregnancy is found to lower risk of hospitalization due to whooping cough in babies less than 2 months of age by 91%. And women who get vaccinated with the Tdap vaccine in the 3rd trimester of their pregnancy, which is the recommended time, prevents 3 in 4 cases of whooping cough in babies under 2 months old. So these are great statistics showing how effective these vaccines are, yet only 1 in 3 women in the US are getting both the flu and the Tdap vaccines as recommended. In the CDC's vital signs, they surveyed, for this particular report, they surveyed nearly 2,100 women between 18 and 49 who were pregnant anytime between August 2018 and April 2019. And they, as I said, found that only 1 in 3 pregnant women got both the flu and Tdap vaccinations. 55% got the Tdap during pregnancy and said that their most common reason for not getting the Tdap vaccine was they didn't know they needed it during each pregnancy. And then for the flu vaccine, 54% of pregnant women reported that they got their flu shot before or during pregnancy. But their most common reason for not getting the vaccine was believing that it was ineffective. Next slide. This is a continuation of the statistics from the vital signs, and it discusses the fact that pregnant women whose healthcare providers offer them the vaccine or refer them somewhere else for vaccination had the highest vaccination rates. And among women whose healthcare providers offered vaccination or provided a referral to another vaccination provider, 65.7% received their flu vaccine and over 70% received their Tdap vaccine. And of course, with a lot of health, different health issues and vaccinations as well, Black, non-Hispanic pregnant women had lower vaccination rates than women of other races, and were less likely to report that they received a healthcare provider offer of vaccines or a referral for vaccination. So this isn't really surprising to hear, but it's upsetting to hear, and definitely something that we have to work on in fixing the disparities in vaccination rates in pregnant women, in adults, in children. So that's more for another time. Okay, moving on. Let's go to the next slide. So ACOG, who I mentioned is part of this Maternal Immunization Task Force, one of the things that makes the ACOG one of the members of this task force is that they received a grant from the CDC, or a cooperative agreement from the CDC, to do a bunch of work on maternal vaccinations. And one of the projects they did was an online survey of 900 pregnant women. And they also did 3 online focus groups of pregnant women on the topic of maternal immunizations. And so some of the information from this slide comes from the survey and focus group results. And then there's also some of the information on this slide that comes from a survey that was done of certified nurse midwives by the Association of Certified Nurse Midwives, which again is another member of this Maternal Immunization Task Force. So when women were asked about, why they're choosing to get vaccinated while pregnant, they said that strong recommendation from healthcare provider is their main reason, or the key driver, whether or not they decide to get vaccinated. That hearing from their healthcare provider really made the difference, and that fact is actually in every survey, everything you'll ever read, anything related to vaccines, it's always the healthcare provider that is really key in helping pregnant women and people of all ages make decisions about whether or not to get vaccines. One thing that of note is that certified nurse midwives said they weren't as comfortable as OBGYNs seem to be in making that strong recommendation about vaccinating, as many certified nurse midwives feel that it is more the patient's decision on whether or not to get vaccinated. So that's something that the Association of Certified Nurse Midwives are working on. And they actually said that a lot of younger nurse midwives that come into the job seem to be more willing to promote vaccinations than perhaps some older ones that have been working in this and were not promoting vaccinations early on, so they're not as used to it. Another thing that came up is that in addition to their healthcare provider, pregnant women also look to friends and family and online sources for vaccine information and advice. That's where Vaccinate Your Family comes in, and Immunize Nevada comes in, I know. On social media, we've been trying to get information out to pregnant women through YouTube and videos, etc. And probably not surprising, they did say that CDC is not always trusted. So CDC as a federal entity is not trusted by everyone, but definitely still by some. Concerns about the effectiveness of the flu vaccine and the safety of the flu and Tdap vaccines, along with knowledge about recommendations for the Tdap vaccine, all of that information is making an impact on whether or not they're deciding to get vaccinated during pregnancy. But one of the things that is really, I think, making the difference and tilting towards vaccinate is if someone talks about the way that vaccines during pregnancy really make a difference in the health of their baby. It plays a significant role in a woman's decision to immunize during pregnancy. Even though she might hear that it's for protecting herself and her baby, hearing that it's actually going to be helping her baby seems to mean more. And also, pregnant women are mostly focused on protecting their own family. The idea of community immunity or herd immunity from vaccines is not the main reason that they choose to vaccinate themselves. You know, it could be a secondary benefit, but it's definitely more about their health, their baby's health, and their family's health. Okay, moving on to the next slide. So this continues to come from the ACOG survey and focus groups of the women on maternal immunizations. When they talked about barriers to why they would not get vaccinated or they don't want to be vaccinated, as I said, the effectiveness of the flu vaccine definitely adds to their doubts. And of course, you know, if you go online, you're always hearing about vaccine safety. There's so much misinformation out there, and we need as many people as possible to be combating that information and just saying, oh, that doesn't sound right the next time you hear that vaccines cause autism or, you know, vaccine ingredients are toxic. We need so many people just saying, no, that doesn't seem right, and then sending people to credible scientific resources for facts about vaccines. Back to this survey results, concerns about vaccine ingredients are definitely going beyond just thimerosal. So I know you might have heard that thimerosal in vaccines is dangerous. I'm not going to go into that right now, but needless to say, there's been many, many, many studies showing that thimerosal in vaccines does not cause any kind of problem for anyone who's had it. And I'm happy to point people to the research on it. But pregnant women, of course, are just like everyone else, and they hear about, you know, different vaccine ingredients, and just telling them that vaccines are safe is not really good enough. They want more specific information from their healthcare providers and from the other sources that they look for online. One of the reasons that they say that possibly flu vaccination is not as strong and causes more questions than Tdap vaccines, even though really the vaccine rates are pretty much equal in that 50%, is that possibly flu vaccine seems more of a fluid recommendation. It's changing season to season. You're always getting a new vaccine every flu season, whereas Tdap is a very standard recommendation, and that might cause some confusion. Also, there was one study, and I'll go more into it, but there was concern about flu vaccination during the first trimester at first, and so it was not recommended that pregnant women get the flu vaccine during that first trimester. Now, pregnant women can get vaccinated during any trimester. The science has been done, and it's shown that it's safe in any trimester. But hearing it for people who might have heard that they shouldn't get it in the first trimester has planted a seed for some. And so they might believe that it's unsafe to get the flu vaccine either during pregnancy at all or during that first trimester. Next slide. So the AFP, the Family Physicians Group, also conducted a survey of their members as part of this maternal immunization task force. And they did the survey of their members, and I believe it's like 18% of their members treat pregnant women. And the survey data was collected in 2019, and they received about 1,112 valid responses. And so some of the reasons that their members or family physicians are hearing that pregnant women are refusing vaccines are safety concerns for their baby. That came in at number one at 64%. Thinking that vaccines aren't necessary because they're healthy. And that's something that did not come up as much on the other slides and from the other surveys. But I know that I have heard this many times, that a lot of people don't understand the dangers of the vaccine preventable diseases, including flu and pertussis. So they don't realize why it's so necessary for them to get vaccinated to protect themselves and their babies. There's also concerns about vaccinating due to personal or religious beliefs, and then safety concerns for themselves, the pregnant women themselves, if they get vaccinated. And then they had these other barriers mentioned, more anecdotally related to dissemination of misinformation from anti-vaxxers, distrust of big pharma, the government, and or the medical community, being concerned about needles, and becoming sick from a vaccine, like catching the flu from the flu vaccine. Next slide, please. So this slide talks more about how you can talk to your pregnant patients about the importance and safety of maternal vaccinations, so flu and Tdap vaccinations. And this comes from the call to action, excuse me, that I mentioned earlier. And I've also added in some information related to, from CDC, that also has a lot of great resources, particularly for healthcare providers, on their website, and talking about suggestions and strategies for increasing vaccination rates, particularly among pregnant women. So when talking to pregnant patients, first, you want to make sure that you're assessing their your patient's vaccine status and discussing early on which vaccines that they're going to need and when. If you could do this during their first prenatal visit, even better. Get them used to the idea. You want to normalize vaccines as a routine part of a woman's pregnancy care as much as possible. This is just one other thing that they need to do to keep themselves and their baby healthy during their pregnancy. Also, if you can help ensure that all the office staff are saying consistent things about vaccines. I think a lot of times, you know, let's say the nurses are saying the right thing, the doctors are saying the right thing, but then there's that receptionist at the front desk who doesn't believe in vaccines and tells the pregnant woman, well, you know, I heard that vaccines cause autism, or I heard that vaccines aren't safe. And so you really want to make sure that your office is a culture of immunization. And there are resources to help you with that. There's some presentations you can give to, so everyone in your office is on the same page and giving out the same messages about vaccines' importance and safety. When you talk to your pregnant patients, you want to be strongly recommending that they receive an annual flu shot in any trimester, and that they get that Tdap vaccine in their 3rd trimester during every pregnancy. You want to discuss the benefits of vaccination again early and often, and reinforce that it's vaccines that are the best way to protect young babies from flu and whooping cough, and that it's super important that the science shows that vaccinating during pregnancy is really going to be the best way to protect their babies. Next slide. So here are just some tips for making a strong recommendation. As I said, you know, everyone says strong recommendation is crucial to vaccine uptake. And for many patients, a strong and clear recommendation from their healthcare provider is going to be sufficient to get vaccinated, accept vaccines. But there are people who might be seeing misinformation or hearing misinformation, and they really need more information from you in order to help them make the decision. So for those who don't want to vaccinate or are questioning vaccines, you can try this strategy for making a strong recommendation. It is evidence-based, and it is called SHARE. It's from the CDC. So you want to share specific reasons why flu and Tdap vaccines are right for your patient as a pregnant woman. For example, you can say the flu shot can protect you from flu, which is more likely to cause you to get severely ill because of changes in your immune system and your heart and your lungs during pregnancy. Also, if you get the flu, you're going to have a greater chance for serious problems with your baby, like premature labor and delivery. Another thing is to highlight the positive experiences with vaccines in order to reinforce the benefits of the vaccines. So if you yourself were vaccinated while pregnant and can talk about that, that's wonderful. If you've never been pregnant or can't be pregnant or etc., you want to just talk about the fact that the CDC, the ACOG, the nurse midwives group, the neonatal nurses, and you all recommend that pregnant women get flu and Tdap vaccinations during each pregnancy. Address any questions that your patient has and take her concerns about the flu and Tdap vaccine seriously. Let her know that she's being heard, and tell her where to find science-based information about vaccines, including the side effects, possible side effects, vaccine safety, vaccine effectiveness, in as plain and as understandable language as you can. Obviously, we know it's all very complex, but the easier you can make it for her to understand, the better. R is for remind her that vaccinating during every pregnancy protects both her and her baby from serious illnesses like flu and pertussis. And then E is explaining the potential costs of getting flu and whooping cough, especially for babies. Okay, next slide, please. So back to these tips for talking with your pregnant patients about maternal vaccinations. So assuming you made your strong recommendations for flu and Tdap, you want to offer these vaccines to your pregnant patients or provide them with referrals to other vaccine providers. We realize, and CDC and all the associations realize, that not every OBGYN is able to purchase the vaccines or store the vaccines at their practice. And so we just want to make sure that you are increasing the likelihood that your pregnant patients will hear that they need these vaccines and then follow through on your vaccine referral. You want to provide them specific information on where they could get vaccinated, such as like a nearby pharmacy or their primary care provider. Sometimes you could write a patient-specific prescription, particularly if it's required, let's say possibly at a pharmacy, although they shouldn't ask for one. It's possible, and with insurance, it's hard to say who will need what. Be prepared to answer any questions on why you don't give the flu vaccine to patients in your office, and emphasize that it's not that you don't believe in the vaccines or believe in their safety, but there's other reasons why you don't stock or provide the vaccines. And then have a plan in place ready to answer questions from other immunization providers who are concerned about vaccinating your pregnant patients. And if you do refer your patient to an outside vaccine provider, just make sure that you follow up with them and document if they were vaccinated in their medical chart. And if you belong to your state's immunization information system, also known as an immunization registry, we definitely want to mark it in there as well, document it in there as well. If a pregnant patient is saying they don't want to be vaccinated, please ask her why and reintroduce the discussion and offer the immunizations again at the next office visit. Sometimes someone's not ready to get vaccinated. They want to, ask you their questions and then think about it. But please don't drop it, and consider, talking to them at each appointment and saying, okay, do you have any other questions about vaccines that I can answer? It's really important that you get vaccinated for the health of you and your baby. And then, of course, you want to be as educated as possible on the safety and efficacy of vaccines during pregnancy, and you want to try to be comfortable communicating this information thoroughly to your patients. Next slide. So as part of the CDC cooperative agreement that I mentioned earlier, ACOG created a new resource, and this is specifically for vaccine advocates. And it's called Pregnancy and Immunization, a Guide to Creating Patient Materials. I'm not sure how many patient or vaccine advocates or people from Nevada health organizations are on the line, but this is a resource that is available. ACOG created it based on an online 90-minute discussion group they had in March 2020 with 25 pregnant women across all states of pregnancy, and they asked them to react to different forms of patient education materials. And the goal was to learn what types of messagings, what type of graphics resonate best with these women, and what information sources are most trusted and easy to use. They also did an in-depth literature review and looked at health literacy best practices and existing maternal immunization education resources, and then they took what they learned from all of these different sources and put it into this guide. So I thought I would just highlight a few issues that they brought up, key highlights. So when messaging about vaccines for pregnant women and you're trying to reach them, focus mostly on the positive effects of vaccines. You want to say that vaccines give you and your baby protection, and they'll create peace of mind. You don't have to worry about your baby getting sick with flu or pertussis because you know that you are helping to protect them. You want to emphasize the health of the mom and the baby, and particularly the baby, as we know that the pregnant women's decision to vaccinate is often centered around protecting her baby. And when possible, use positive framing versus the negative framing. Be mindful that everyone that looks at your materials or looks at your graphics or whatever you're creating is not coming in with the same education about vaccines or the same level of acceptance to vaccines. When you're talking about the science behind vaccinating and how vaccines work, as much as possible, try to talk about the concept of immunity and how it creates antibodies, some which are transferred to the baby to give protection against diseases, but try to avoid medical jargon, scientific jargon as much as possible. You don't want it to be too complex. You want it to be as easy for them to understand. And they can always ask more questions of their healthcare provider, or perhaps you have more information on your social media pages or online for them to get deeper information on vaccines. When you're talking about the baby, they don't recommend you use the word fetus. Pregnant women much prefer the word baby or developing baby. And once again, they mentioned the importance of a strong recommendation from healthcare providers and a strong recommendation from anyone talking about vaccines for pregnant women. And they also mentioned that they think printed materials should be the primary way for educating them about vaccines. And digital formats and social media should be more secondary. Even though definitely there's some pregnant women expecting mothers who are going to seek out information online and from online, groups, Facebook groups, etc. And then related to content formatting of your materials or graphics, when possible, use a question and answer format and use credible sources of information with prominent branding. CDC and ACOG are known as places to get credible information about vaccines for people of all ages. And then just make sure if you're using any kind of imagery or symbols, use ones that should be familiar to your audience, because not all symbols or images are universal. Next slide. I just wanted to highlight two infographics they're infographics / they could be printed out. And they were created by ACOG based off of a lot of what they learned from their focus groups. And they talk about, why you need the Tdap vaccine and why you need the flu vaccine. And so anyone is able to use any of ACOG's materials. I put the links, the URLs where people can find these materials, but you can put them on your practice's website or a patient portal or a Facebook or a Twitter page to help ensure that your patients or pregnant women have access to accurate information on maternal immunizations when they're not in your office. Also, they have some accompanying text available to put in a post if you're putting it up on social media or on your website. And they said there is a Spanish version coming soon. Next slide. So this is just a bit of information, since we know that pregnant women are very concerned about the safety of vaccines for both them and their babies. I wanted to let you know some talking points about the safety of flu vaccines during pregnancy and where you can find some of the studies that talk about this. So there are many studies that show flu vaccines during pregnancy are safe and effective for pregnant women and their babies. They've been given to millions of pregnant women over the many years, and they continue to have a good safety record. Flu shots are made of inactivated or killed bacteria or viruses, and they cannot give people the flu. It's just not feasible, even though people might think they feel sick after getting a flu shot. They don't have the flu. from the flu vaccine. Let me clarify that. From the flu vaccine. They might have gotten the flu previous to that. It takes 2 weeks for the vaccine to be effective and start giving protection. Babies of women who received the flu shot during their first trimester had no increased risk of having a major birth defect, and pregnant women can safely get the flu and Tdap vaccines at the same time. Getting a flu vaccine while pregnant does not increase the risk of miscarriage, and there are safety monitoring groups in place. So there's, when a flu or a Tdap vaccine, and every vaccine in the US is being studied, they are studied for efficacy and safety during clinical trials. And then once they're approved by FDA, they are still being monitored by CDC and FDA through 4 different safety monitoring systems that are in place here in the US. And so one is called VAERS and one is called VSD, which stands for Vaccine Safety Data Link. But it's basically different ways to just make sure that the vaccines that are being given out to people are continuing to be effective and safe. Next slide. This talks about the efficacy studies that have been done on flu vaccines during pregnancy. You can see what's in the slide, but basically demonstrating that the flu vaccine is indeed effective in protecting against flu, particularly serious flu illness and complications from flu like hospitalizations and even death. There's been a lot of large randomized controls trials and observational studies that have been done showing that flu vaccines do protect pregnant women and their babies from serious flu illness and hospitalization. Next slide. And this slide just talks about the safety of Tdap vaccinations during pregnancy. Again, showing that there's low risk of severe side effects from getting a Tdap vaccination during every pregnancy. And that even if a pregnant woman has gotten a different tetanus containing shot, like the TD vaccine, let's say they got that to prevent against tetanus just a little while ago and then they get pregnant, they still do need that Tdap vaccine that contains the pertussis element, so they are protected from whooping cough and they are protecting their baby from whooping cough. Just like the flu vaccine, the Tdap vaccine cannot cause pertussis itself. And CDC and FDA are monitoring vaccine safety during pregnancy using the vaccine safety systems. And vaccine manufacturers of the Tdap vaccines have also created a pregnancy registry to help collect information from pregnant women who get their vaccines. They want to make sure that they're safe as well, and there have been no safety concerns reported. And then breastfeeding is safe after getting a Tdap vaccine during pregnancy, or even right after you give birth. It's safe for your baby to have that in the breast milk. Next slide. This is just some examples of what Vaccinate Your Family has been doing to communicate out to pregnant women as a national organization. And so we have our Instagram page at Vaccinate Your Family. And you can see some of the different posts that we've put up and the different graphics we've created. The Be a Superhero for Your Baby graphic has been one of our most popular. And I will say that I did do this vaccinating during pregnancy gives protection and peace of mind graphic after hearing the data from ACOG. That one did not do as well. So I'm gonna have to mess around with that more and try to figure out what graphics or what way of creating the graphic might work best to try to get that information out. If you look at the next slide, this just shows some of the graphics we've used on Facebook and Twitter. Please follow us on our different social media pages. We love to have you join the conversation. And then the next slide shows some new graphics that we've created for this flu season. and they are coming soon. We hope you will like them, share them. So these are the ones we have specifically related to flu vaccine during pregnancy is safe, and we will see how they go, and hopefully they will be well accepted and shared a lot. Next slide, please. So we have a website, vaccinateyourfamily.org, and we have a pregnancy section, vaccines before pregnancy, during pregnancy, and after pregnancy. And so please visit our website and send your patients to our website for credible science-based information. Next slide. We also work in a collaboration with Anthem and Pfizer on this project called Let's Vaccinate, and it's a website, letsvaccinate.org. It's a website of credible resources and strategies to help healthcare providers increase their vaccination rates. We also have the sections related to vaccines during COVID and flu season and the importance of strong vaccine recommendation. We hope you'll take a look at it. It's all existing credible resources from other national partners. Next slide. I just wanted to quickly show this to you all. I know we don't have tons of time, but this is a personal story that we created to help educate people about the importance of Tdap vaccination. And it's we've been advertising it on social media and through Hulu in a variety of ways. Brianne, can you just push play so people can see the type of story we have that we're hoping other people will share and send people to?
I apologize, Jennifer. Are you guys hearing the audio on that? I just wanted to confirm.
I did not hear the audio.
Okay, we'll go ahead and be sure. Yep, we'll be sure to share that. I apologize to our audience. We'll share that in the post-webinar follow-up email so that you guys can hear and see that video.
Great, thank you. Appreciate that.
Of course, sorry about that.
No problem. I just wanted to let people know that one of the reasons that we decided to do this video, and then we have 4 other videos of people talking about how different vaccine preventable diseases have affected their families, is because as I mentioned earlier, a lot of people don't realize how serious vaccine preventable diseases are, and they don't understand why the vaccines are there, that they are going to help protect the lives of the people that you love and protect your community. So this is just one of the stories, and you can see our other stories in the personal stories section of our website, and the link is here, or you can go to our YouTube channel. Next slide. So in addition to the stuff we've been doing on social media and the videos, we've also been working with the USDA's and the National WIC Association for many, many years on ways to educate low-income pregnant women and mothers of young children participating in WIC about the importance of vaccines for children and for pregnant women. So we have an annual webinar with the WIC staff to let them know the latest in vaccines and vaccine recommendations. Our next webinar is actually this Friday, and you can see archive webinars from our vaccine resources section in our website. We also create materials specifically for WIC staff and WIC participants, and you can also see those in the vaccine resources section of our website. And then the new thing we have is a vaccine lesson that we created in English and Spanish, And it's to help educate WIC participants directly about the importance of vaccines for pregnant women and vaccines for young children. It was launched in March, and it's available on wichealth.org, which has other educational lessons for WIC participants, but those are all on nutrition. And this is the only one that's not on nutrition, but is on the topic of vaccines. And since launching in March through August 31st, we've had over 4,500 lessons completed, mostly in English, some in Spanish. And if you're interested in this, there are a lot of, so the states have to actually, the state WICs have to decide that they want to offer this to their WIC participants. And I think we have about 30 that are already offering it. But if you have questions or want your state WIC to be offering this to the WIC participants or clients, please let me know, contact me. My information's on the last slide and I'm happy to tell you more about it. Next slide. This is, I know we have very limited time, so I just wanted to show you some online ads that we did to reach pregnant women about both maternal and childhood vaccinations. And we had people see these ads and then click on them. When they clicked on them, we sent people to our website, the area specifically on pregnancy vaccines. And if you go to the next slide, you can actually see some of the animated ones. I don't know if it'll be moving for you guys, but you can see that they were animated. The animated ones did better than the static ads. And they all did about the same. The only one that didn't really do well is the Asian woman looking at her phone, pregnant woman looking at her phone, asking if vaccines are safe for her baby. I'm not quite sure why, but that one didn't do as well. If you go to the next slide, we can go past that one. The next one with the ads on mobile phones. Oh, did I miss one? Oh, sorry. Okay, so the next slide. So in addition to doing our online ads, we also did some mobile targeting of people in 7 demographic areas, or 7 like big city areas in the US. And we targeted people on their mobile phones in Bye Bye Baby and Carter's with a scrolling message across the bottom of their phone, like a kind of like a CNN news ticker, or also it's on every news channel now, just the little thing going across the bottom. And they actually went really well. They did even better than the online ads. If you go to slide 31, I just wanted to tell you the most popular messages that seem to get the most clicks and people going to our website for more information. Not sure what to buy, make an easy decision, get vaccinated during pregnancy to protect you and your baby. Learn more now was the #1 in both all the Bye Bye Baby stores and the Carter stores in the 7 demographic areas. Second most popular at Bye Bye Baby was about the OBGYNs and midwives agreeing that vaccines are safe and effective for you and your baby. And then the second most popular one at Carter's was about getting the flu shot while pregnant to protect your newborn from serious illness and from being hospitalized. See how. So those messages are something that you might want to try depending on how you're communicating with people, but something to think about. Next slide. So this is just a list of credible resources for both healthcare providers, prenatal providers, and for pregnant women. And this is different resources that I've mentioned and some other ones that I didn't mention from the 4 different maternal immunization task force members. And you can go back and look more at what's available. And then the next slide actually shows one of the resources that was created was from AWHONN, the neonatal nurses group, and they created a flu vaccine video and a Tdap vaccine video. And I know we probably won't play it because of limited time, but I just wanted to let you know these things are available and they help to explain the importance of vaccines for nurses. Next slide. is, again, some more credible resources from the CDC, from Vaccinate Your Family, our group, and then some additional websites and resources that you might want to look at from other national partners that we work with. And finally, contact me if you have any questions. I know I went way over. I apologize. I really want to get to your questions, but feel free to email me or email Brianne and the questions will get to me. Thank you.
Thank you so much, Jennifer. We'll go ahead and just take a little bit of time to answer these questions that we have in already today. Also, I just wanted to remind participants that this slide set and the recorded presentation will be available on immunizenevada.org/webinars so that you can play the videos and click through the links and kind of take a closer look and a deeper dive at that information that Jennifer shared today. I mean, there was so much useful content, and so we'll be sure to get that up within the day for you folks. So we'll take time to answer some of the questions that have came in. We had a question come in asking about the safety of the flu vaccine or recommendation for flu. That was really early in the presentation. I think, Jennifer, you answered that. Asking if you're pregnant when receiving a vaccine, I think it's more so for screening purposes, for the purpose of, live vaccines that shouldn't be received in pregnancy, and
Right.
Not the flu vaccine. So
Right, yes.
hopefully that answers that question.
Yes, I just wanted to clarify that, yeah, both flu and Tdap vaccines are not live vaccines.
Yes.
So that's why it's even more certain that they won't cause the diseases that you're vaccinating against.
Absolutely. The next question that came in is, are the majority of pregnant women accepting of the recommendations for vaccination during pregnancy, or has there been strong hesitancy among many women?
So according to this 2019 data from CDC, I'd say about half of pregnant women are getting their flu and Tdap vaccinations. But we definitely need to get more to be getting them. And that's why it's so important for healthcare providers to be giving that strong recommendation and whenever possible, offering that vaccine in their office practice. And if not, at least telling them where they can go to get their vaccine and following up to make sure they actually did it. So yes.
Perfect. And then we had a question about what research do you have that states women prefer the print content as opposed to digital? That was coming from that March survey or panel from ACOG, correct?
Yes. So you can see, and I'm not sure if I put the link there. It is from ACOG's, oh goodness, the ACOG document that they just put out from their 25 people in their focus group plus literature search, and we can send you the link so you can see more information on that. And if you want, we can probably connect you with someone at ACOG who could better talk about that.
Perfect. And then it looks like the last question that we have is it also helpful to talk about immunizations for after the baby is born? So Hep B at birth was an example when introducing immunizations or the concept of immunizations to moms.
Yes. So we know that a lot of pregnant women are actually making the decision on whether or not they're going to be vaccinating their children in the second trimester of pregnancy, and they're not, and once they have the baby, the decision is basically staying because they're not asking anyone about childhood vaccines until I believe it's the baby's second month well visit. And so, yes, whenever possible, if you're willing, if you are seeing pregnant women and are willing to talk about the fact that their child's going to need the Hep B vaccine before they leave the hospital, and tell them where they can find information about childhood vaccines, science-based information about child vaccines, like Vaccinate Your Family's website or CDC or any of the other resources I listed, please send them, because yes, they are definitely thinking about it, and it's a great time to reach them with that information.
Perfect. So I think that addresses all the questions that we had in the Q&A portion for now. I would just like to thank you, Jennifer, for offering up your expertise and for presenting today. Again, if you'd like to view or share the webinar, the recording will be available on Immunize Nevada's website. And with that, we will go ahead and conclude today's presentation. I hope our audience has a great rest of the day. And thank you again, Jennifer.
Thank you. Thanks for having me. Bye. Stay
Bye.
safe, everyone.